This study has been scaring a lot of people. You may have seen it being shared by people like this. And yet it's easy to glance at it, see these words, and immediately either think, ha, I told them so, or to assume there must be a problem and discount it. But if you're on team science, that means you critically evaluate all new evidence with an open mind. So let's put on our critical thinking hats and dive in. It was an observational study that used Medicaid claims billing data. It looked at 47,155 children enrolled in Florida Medicaid ages 0 through 9. And it defined groups as vaccinated, unvaccinated, and having neurodevelopmental disorders like autism based on the presence or absence of those billing codes. It concluded that vaccinated children were between 2.7 and 6.8 times more likely to be diagnosed with these disorders. It then compared the number of vaccination visits with the odds of an autism diagnosis. And it found that those with a single vaccination visit were 1.7 times more likely to be diagnosed with autism, all the way up to 4.4 times the risk in those with 11 or more vaccination visits. That last 4.4 number is what he used to say that nearly 80% of all autism diagnoses in the US are caused by vaccines. This all sounds quite scary, but let's break down 4 key flaws, the fourth alone being enough to make the results highly questionable. First, this was an observational study which can never be used to determine causation. If crocodiles cause autism, and every autism clinic was next to a crocodile swamp, this study would still observe the vaccine correlation. Think about that. Second, using Florida Medicaid billing codes as the sole data source is highly unreliable, especially because people could have gotten vaccines from other providers or other states. Third, they chose to only count autism diagnoses that were diagnosed between the ages of 5 and 9, when it can be reliably diagnosed by age 2, and on average, it's diagnosed by age 4.9. It could be that younger numbers didn't support their desired conclusion, so they drew the line there, which could be called cherry-picking data. Fourth, the clincher. They didn't adjust for confounding factors like these, the key one being healthcare-seeking behavior. If a family doesn't trust doctors, they're a lot less likely to take their kid to a specialist to get the diagnosis of autism, just as they're less likely to get them vaccinated. But that case would still show up in this study as an unvaccinated child without autism. And to close it off, the study was published by an independent website made to look like an academic journal, but is owned by the same organization that funded the study. A big no-no. And most of the journal's editorial staff work for RFK Jr.'s anti-vaccine advocacy group, Children's Health Defense. Interesting timing given that RFK's confirmation hearing is this week. And it benefits him to make his past anti-vaccine campaigning and profiting to seem more legitimate to those unfamiliar with reading scientific research. So spread the word for science.